Welcome to my little bird's eye view of prenatal yoga. Have you ever wondered which yoga asanas are beneficial or possibly risky during pregnancy and in the early postpartum period? Have you ever wondered which asanas are indicated and contraindicated during each trimester? How do these prescriptions vary depending on the unique woman and specific conditions? These and other questions pertaining to prenatal yoga did not appear in yoga literature until the late 20th century. In the 18th century, literature indicated that moderate exercise was encouraged for pregnant women, but any type of agitation to the body coming from violent or improper exercise was to be avoided. Examples during that time were riding in a carriage on horseback, dancing, or anything that disturbed the body or the mind. In the 19th century, physical activity during pregnancy was examined more scientifically, noting association between robust activity and lower birth rate, which led to legislation in several countries, except the United States, prohibiting employment of women weeks before and after delivery. In the early part of the 20th century, a growing list of arbitrary restrictions on physical activity during pregnancy were running rampant, but they stemmed more from cultural and social biases as opposed to scientific study. Examples of restrictions during that time ran the gamut from bathing, swimming, golfing, dancing, horseback riding, tennis, and excessive walking. In the 1930s, although highly criticized, a British writer and maternal advocate known as Kathleen Vaughan advocated for pregnant women by encouraging exercises that would improve joint flexibility, widen the pelvis, and prevent tears of the perineum. It wasn't until the latter part of the 20th century where control over the body and a sense of well-being became the emphasis. But basic physiological changes such as aortic compression syndrome, laxity of joints and ligaments, exaggerated lumbar lordosis, and abdominal compression issues continued to be ignored. More so, there were unexamined assumptions that failure to engage in some sort of prenatal exercises could damage the unborn child and the mother. Therefore, many pregnant women began to quickly immerse themselves in random exercises that often predispose themselves and their baby to injury. Within the past 20 years, we have gained vast insight into the relationship between exercise and pregnancy. There's clear evidence that normal daily activities do not compromise the mother or baby in any way, unless a significant pathological condition exists. Ever-growing conventional wisdom suggests that exercise during pregnancy should be regular, as opposed to intermittent and not competitive. If it is vigorous, it should not be in intense heat or humidity or with high fever, nor should it build internal heat. In addition, any type of ballistic or jarring movements, including deep flexion and extension of joints, should be avoided. And if starting from a sedentary lifestyle, the woman must begin with very simple exercises. It is important to note that these insights come to us through a Western medical and scientific lens. Even though there has been an accumulation of evidence proving that emotion is a highly significant factor in pregnancy and in delivery, the Western lens still assumes that the mind and the body are separate systems and that they do not interrelate. Luckily, there's an increasing number of hospitals and birthing centers that recognize how emotion regulation eases the way into labor. Therefore, they offer a more peaceful environment and encourage conscious breathing and meditation practices to soften labor and delivery. And here is where our practice begins. If conscious breathing and meditation practices have proven to be helpful during delivery, imagine the benefits a woman can reap by practicing yoga throughout her pregnancy. Before we begin, let's keep in mind that pregnancy is not the time for expectant mothers to begin a vigorous yoga practice, nor is it the time to attempt new or more complex asanas. With that in mind, there are two basic categories we need to consider when practicing or teaching prenatal yoga. Category 1 is for women that lead pretty sedentary lifestyles, exhibit poor physical health, and are considered a high-risk pregnancy. The second category is for women that lead pretty active lifestyles, exhibit good overall health, and also exhibit minimal pregnancy risks. Women in the first category should be encouraged to attend yoga classes designed specifically for pregnant students, which are typically referred to as pre- or postnatal yoga. Women in the second category should be encouraged to explore practicing in regular yoga classes with teachers who are prepared to give them informed guidance on when and how to modify practices. Women in this category already practicing yoga regularly should be encouraged to do a maintenance practice along with modifications that I will share with you in the following slides. Before we begin to break down yoga practices by trimester, an area of focus that all pregnant yogis can benefit from is bringing greater awareness and support to the structure, muscles, and organs of their pelvis. This can usually begin well before pregnancy, but is highly encouraged from the onset of pregnancy and throughout. This awareness begins with a more focused practice of using Mula Bandha as a tool for toning and refining one's awareness of the lower pelvic muscles and organs. Furthermore, Mula Bandha helps to develop stronger and more flexible set of perineal muscles, awareness of the lower pelvic organs and surrounding support structure, greater ease in the delivery process, reduction in physical risks during pregnancy, labor, and delivery, such as urinary incontinence, vaginal prolapse, this is where the bladder, uterus, or bowel protrudes into the vagina, perineal tears, or reduced indication of episiotomy, which is a surgical cut made at the opening of the vagina during childbirth. Let's take a closer look at early pregnancy and first trimester practices by noticing some asanas that promote pelvic awareness. Starting off, we have Setu Bandha Sarvangasana. This pose, when we include rolls, which means we undulate the pelvis and spine slowly in and out of the pose, helps to loosen the hip muscles. Moving on, we have Sapta Baddha Konasana. This is a wonderful pose that helps to open the hips and stimulate circulation, freeing energy flow in the pelvic area. Swastikasana involves a deeper internal rotation of the hips. Vajrasana, also known as thunderbolt pose, strengthens the pelvic muscles and improves blood circulation. Virasana, hero pose, stretches the hips and improves circulation as well. Here we have Upavista Konasana. This is a wonderful way to increase blood flow to the pelvic region. Gomukhasana relieves stiffness in and strengthens the hips. Ananda Balasana, known as happy baby pose, is a wonderful groin stretch and hip opener. Pigeon prep is another way to open the hips and also lengthen the hip flexor. And last but not least, my all-time favorite, Malasana, is an intense hip opener and groin stretch. The first 13 weeks of pregnancy tends to be a very intense and delicate period of transformation. Women are encouraged to take it easy as they adjust to their changing hormones and energy levels. During this transformative time, the goal is to become more grounded by slowing down a bit and focusing more on the inside, creating a favorable environment for the ovum to grow into a healthy fetus. Pranayama is extremely beneficial during pregnancy and childbirth. It helps to relax if feeling tired, anxious, or stressed. It also allows one to revitalize when energy levels are depleted. Three types of pranayama that are safe and encouraged during pregnancy are Ujjayi, which helps soothe the body and mind while providing breath awareness and practice for childbirth. Nadi Shodhana is especially great for promoting emotional and mental balance while cooling the body. And Brahmari humming bee. This type of humming breath that is created upon exhaling is thought to be soothing and nourishing for both mothers and babies. Following, we have meditation. Meditation has proven to be an important tool during pregnancy, for it helps support the well being of both mother and baby by calming the mind, the body, reducing anxiety and anger, and eliminating stress. Meditation helps a mother achieve higher levels of patience, awareness, and tolerance, which will come in handy once baby arrives. Most of all, meditation allows the mother to connect with her baby and begin to communicate with her baby while in utero. Following, we have gentle movements. The first trimester is the most critical and when a mother is most vulnerable in her pregnancy. At this time, the baby will be developing all its vital organs like its lungs, brain, and heart. With that in mind, it's important to keep a gentle flow, remembering not to jolt the body by jumping into asanas. From here, we're going to move into the topic of minimizing twists. Deep twists below the belly during pregnancy are contraindications because of the possibility of straining the abdomen and uterus. Focus on twisting movements in the upper thoracic spine and away from the leg during this time. Creating a stable foundation can be achieved through hip opening asanas that help stimulate circulation in the legs and feet, creating strength. A few asanas that are very beneficial in creating a stable foundation are Utthita Trikonasana, Virabhadrasana or Warrior Two, and Utthita Parsvakonasana. Finally, exploration of props and asanas that will be used in the second and third trimesters are highly encouraged during this time. I will talk more about these props and asanas in the slides to come. As women embark on their second trimester, they find that pregnancy is generally well established, where the placenta has become fully functional and hormone levels have balanced out. This is the perfect time to begin to focus on cultivating strength and stamina while refining pelvic and spine awareness in order to build more internal support for the inevitable challenges that come with trying to balance as the baby continues to grow. Now is the time that a woman's belly begins to show, albeit not all women present the same growth at the same time. It's paramount to keep in mind that as a woman starts to show, the pelvis is no longer protecting the uterus, Therefore, it's time to start adapting poses that will help keep mother and baby safe. An area of focus when practicing yoga during the second trimester is building inferior vena cava awareness. As a woman approaches the middle of her second trimester, a sense of numbness takes over while lying on her back because the increasing weight of the baby places pressure on the vena cava. This pressure creates numbness because blood flow back to the heart becomes restricted. With that in mind, we want to avoid all asanas that can potentially add pressure to the vena cava. In the second trimester, we want to avoid jarring movements and intense abdominal work, such as yogic bicycles, navasana, and kapalabhati pranayama. It's super important to avoid pressure on the abdomen and to develop a supple belly because tighter abdominals create a downward pressure, placing women at high risk of perennial tears and urinary incontinence. Beneficial during this time is the use of pelvic neutrality exercises such as Tadasana and Urdhva Hastasana to cultivate alignment of the spine. Mothers-to-be during this time should practice Surya Namaskar with feet apart when in Tadasana and step, not jump back into plank. When lying down, it is necessary to use folded blankets in order to support the ribs and hips. It is also beneficial to integrate squats into the salutations during this time. In addition, we want to practice standing asanas such as Virabhadrasana or Warrior 1 and 2, Uttita Trikonasana, and Parsvottanasana in order to develop or maintain leg strength and to open the hips and pelvis. When needed, these asanas can be modified using a wall or a chair for support. This is a great time to explore a variety of seated hip openers as well, such as forward folds, including Baddha Konasana, Parivrita Janu Sirsasana, Dandasana, and Paschimottanasana. Keep in mind when in Paschimottanasana, we want to make sure that the legs are apart. It is also valuable to practice relaxation poses such as Viparita Karani, with legs straight up the wall and with feet together and knees apart. Elevating the feet in Baddha Konasana is encouraged, as is raising the hips and legs onto a long bolster when in Savasana. We are now moving into the third trimester. During this phase, the goal is to integrate the practice more fully. Therefore, the aim is to refocus on cultivating energy, especially by resting throughout the flow of asanas. At this point, the baby is ever growing. Therefore, it becomes increasingly important to limit the time lying in supine because, as stated earlier and worth mentioning again, these positions allow the baby's weight to place great pressure on the vena cava, restricting blood flow to the mother's heart. Pivotal to mention at this point is the hormone relaxin. Relaxin is a pregnancy hormone that is produced in the placenta and often surges when the baby has a growth spurt and the body adapts to the ever-growing fetus. This surge softens the cervix and tissues of the birth canal in preparation for childbirth. It's actually a spectacular natural process, but unfortunately, there is a downside. Relaxin produces overall muscle laxity, which means that ligaments and tissues throughout the body are softened, which can result in widespread joint instability and pain. The pelvis can also become hypermobile and cause pain in the sacroiliac joints located on each side of the sacrum and in the pubic bone. Women at this time are very susceptible to sprains and breaks, so we really need to keep this in mind when creating asanas and flows during the third trimester. At this time, we want a mother to continue to work on postural alignment in order to give support to the spine. This is also the time for mothers to be to become increasingly familiar with using a chair to support a variety of standing and sitting asanas such as Virabhadrasana and Malasana, and using high bolsters for long holds in Supta Baddha Konasana. After the 36th week, it is important to note that Adho Mukha Svanasana and inversions can cause or even reverse breech presentation. Mothers should now begin doing birthing visualizations, squatting, and other abducted hip opening positions. And in order to promote ease and comfort and relaxation, rest in Savasana should be done by lying on the side of the body with props between the knees, under the head, and under the upper arm. Baby is here and a new adventure has begun. After giving birth, it is important for new mothers to slowly increase energy, redevelop muscle strength, and cultivate more endurance. I am going to stress one more time the word slowly. During this time, there should be no abdominal pressure from core work. Also, there should be no abdominal pressure from Kapalabhati pranayama. These restrictions should remain for at least 6 weeks unless there is an episiotomy or perineal tear. For in these cases, restrictions should last longer in order to allow for complete healing before starting pelvic floor exercises. The goal is to gradually move back into toning and abdominal core work. It's paramount to keep in mind that there are still heightened levels of the hormone relaxin for about 2 months postpartum, and even longer if breastfeeding. Therefore, it's safest to stay with an 80% practice when doing deep stretches, especially forward folds and back bends. Pregnancy and childbirth are definitely hard work. Although a mother can't account for special circumstances arising during pregnancy or birth, she can look out for herself and her baby through holistic yoga practices that focus on prenatal asanas, breathing, meditation, and deep relaxation. It is empowering to know that one can enjoy a healthy pregnancy and positive birth by embracing natural and holistic ways to stay fit in mind and body throughout gestation. Namaste.